ectopic thyroid and thyroglossal duct cyst. Both of these lesions can be seen at the midline of the neck. So we here are trying to find the main radiological findings in between. Okay, so thyroglossal duct cyst can be seen anywhere along the pathway of the thyroglossal duct. So can be seen at the base of the tongue or anterior to the hyoid bone or anterior to the thyroid cartilage. Okay. However, ectopic thyroid usually seen at the base of the tongue. Okay. And that's why it's called lingual thyroid ectopia. So here, this is a thyroglossal duct cyst seen either at the base of the tongue or anterior to the hyoid bone or anterior to the thyroid cartilage, okay, along the pathway of the thyroglossal duct. So here, this is a thyroglossal duct cyst at the base of the tongue. This is a thyroglossal duct cyst anterior to the hyoid bone. This is a thyroglossal duct cyst anterior to the thyroid cartilage, okay? You will notice that the thyroglossal duct cyst is not just anterior, but anterior and slightly or just inferior, okay? Anterior and just inferior, as you can see here. Thyroglossal duct cyst here is anterior and just inferior to the hyoid bone, okay? Here, this is the hyoid bone, and this is the thyroglossal duct anterior and inferior to the hyoid bone. Okay. Another example here. This is the hyoid bone, and this is the thyroglossal duct cyst. Okay. It's anterior and just inferior to the hyoid bone. Okay. And here the thyroglossal duct cyst anterior and just inferior to the thyroid cartilage. This is a specific criteria of the thyroglossal duct cyst, okay? However, the lingual thyroid or ectopic thyroid usually seen at the base of the tongue, okay? It is usually seen at the base of the tongue, okay? Okay. Second difference, the ectopic thyroid, how it appears on the CT scans, okay? This is a thyroid tissue, okay? So it will be hyper dense on non-contrast CT, and it will avidly enhancing on contrast enhanced CT because this is a thyroid tissue. Why it will be hyper dense on non-contrast CT? Because it contains iodine, okay? This was a question in the FRCR 2A. Okay, however, the thyroglossal duct cyst is a cyst, so it will be hypodense on non-contrast CT and it will not enhance on contrast enhanced CT. So let's see. This is a cyst, a thyroglossal duct cyst, so it will be hypodense on and non-enhancing on the contrast enhanced CT scan. So this is a contrast enhancing CT scan, and this lesion is non-enhancing midline cystic lesion. Non-enhancing midline cystic lesion on the post-contrast CT scan, indicating that this midline lesion is thyroglossal duct cyst. Okay, this lesion is not enhancing on the contrast enhanced CT scan, not enhancing on the contrast enhanced. Okay. However, the lingual thyroid ectopia or ectopic thyroid, the lesion will be hyperdense. as you can see, this is hyperdense lesion on non-contrast CT scan. So this lesion is hyperdense lesion, as you can see here, on non-contrast CT scan. Okay, because this lesion contains iodine. This lesion contains iodine because this is a thyroid tissue. That's why this lesion appears hyperdense on non-contrast CT scan. However, this lesion, this is another non-contrast CT scan. Okay, this is another non-contrast CT scan, and the lesion is hyperdense lesion at the base of the tongue. Okay, hyperdense lesion at the base of the tongue. This is thyroid tissue, ectopia. Okay. Okay, the next difference, the ectopic thyroid is a thyroid tissue. Okay, so it will be intermediate to high signal, the same signal of the thyroid tissue on MRI, intermediate to high signal on T1 and T2. However, the thyroglossal duct cyst is a cyst, so it will be low signal on T1 and high signal on T2, the same signal of any cystic lesion. Okay, this is a lesion seen at the base of the tongue, low signal on T1 and high signal on T2. So this is a cystic lesion. It's not thyroid tissue. This is most likely to be a thyroglossal duct cyst at the base of the tongue. Okay. However, this lesion is seen at the base of the tongue is of intermediate signal on T1 and intermediate to high signal on T2. Okay, and enhance. This lesion enhances on the post-contrast sequence. Okay, that's just like the thyroid tissue. So this lesion is of intermediate to high signal. On MRI, this lesion is most likely to be thyroid tissue and not cystic lesion. This is not the signal of a cyst. So this lesion is most likely to be lingual thyroid. Okay. So next difference is technetium pertechnetate scan. Okay. So thyroid scan in ectopic thyroid will show increased uptake at the level of the chin just behind the tongue. As you can see here, this is a child with congenital hypothyroidism. Okay, congenital hypothyroidism. So this is a technetium pertechnetate scan. Okay, so these are two markers. One is put at the chin, at the level of the chin, and the other is put at the suprasternal notch. Okay, why? Because between the level of these markers, thyroid uptake should be seen here between the chin level and the suprasternal notch. And here in this child, there is no uptake or no activity, no thyroid activity is seen on the thyroid scan because this child has congenital hypothyroidism. However, there is a faint uptake is seen just above the level of the chin, and here on the lateral view, this is seen behind the level of the tongue, just behind the level of the tongue. Okay, so here faint uptake just above the level of the chin because this is the marker at the level of the chin, and this is the marker at the level of the suprasternal notch. Okay, so here is another example. Okay, this is a CT scan of a child showing what is this? This is an ABG enhancing lesion at the base of the tongue. Okay, because this is a contrast enhanced CT scan and avidly enhancing lesion. This is an avidly enhancing lesion on the post-contrast CT scan at the base of the tongue. So this is an ectopic thyroid tissue, okay? And on the thyroid scan, as you can see here, there is no thyroid activity at the expected region of the thyroid gland. However, there is increased uptake at the level of the chin, okay? So this is an ectopic thyroid tissue, okay? So I think that's all for the main radiological differences between ectopic thyroid tissue and thyroglossal duct cyst.